Thanks, Jennifer. Are we ready in the room to get started?
I'm in the room. Some of them get like rubber skin.
Can you hear us, Tina?
Yep, I can hear you. Are you ready?
I think we're ready.
All right, perfect. Well, good morning, everybody. The time is 10:02. We'll go ahead and call the meeting to order this morning. Just a few things. Thank you to our hosts there in Steamboat for hosting the in-person portion, and thank you to everybody who's joined us online. Apologies for not being there today. Scheduling just didn't allow that for me today. Jody is at her capstone this week for CPE, so I am filling in for her. Again, I think Jennifer put the sign in the chat, so those of you online, go ahead and hop in there and do that. Jennifer, I'll go ahead and turn it over to you for roll call.
All right. Good morning, everybody. Get everything out of the way here. So we have Scott James or alternates for CCI.
Here.
Okay. CML Jeremy Shutback.
I'm here.
Good morning. I believe we have Sarah Schober here for proxy for Cheryl. Is that right? I think I saw her in the chat.
Yes, I'm here. Good morning.
Good morning. At-large member Chad Weber. The ESP rep Tim Kunkelman.
I am here.
Good morning. The ESP rep Sean Ward and Trotto. I like rep Jeff Winkleman.
Good morning.
Good morning.
I'm sorry, Mary Staples for Entrado. I couldn't get off mute, sorry.
No problem. Thanks. I like rep Darla Joseph and NTC. Wireless rep Jenny Santana. Wireless rep Ryan Hope Vieiro.
Hello, yes, I'm here.
Good morning. Select VoIP Cindy Harkop with Cinch.
Cindy's here.
Good morning. Select VoIP Jay Slater with Bandwidth or alternate.
Jay Slater's here.
Good morning. 911 starting now. Jody Chin.
Good morning, I'm here.
Good morning. Danette Martin. Cindy Castile. Kimberly Culp.
This is Kimberly, I'm on.
Good morning. Jackie Reynolds.
Good morning, this is Jackie.
Good morning. Beth Abransky. I can't see the chat, but I saw her earlier, so I'm going to mark her here. Felicia Librand.
Felicia's here.
Good morning. Jeff Urban. Ronnie Magruder.
I'm here.
Good morning. Deanie Shin. Or Shannon Brand, alternate.
No other, she put in chat, she's here.
Oh, perfect. It's hard to go back and forth.
And Beth is showing chat also.
Yep, I saw her. Thank you so much. Andrew Dameron.
Good morning.
Good morning. Michael Brewer or alternate.
Michael Brewer's here. Thank you. Good morning.
Good morning.
Jeff
Tina-
Irvin's here. He just posted in.
Thank you so much. Tina Bonetto or Scott Newman, alternate. Kathy Rayleigh. Kathy might be joining late. She had an conflicting meeting. She said she would be here later. Matt Gage or Alex Wall.
Good morning.
Good morning. Carl Stevens.
Here.
Good morning. Patty West or alternate.
I am here.
Good morning, and you do have a quorum. Tina, would you like to go around the room for introductions in the room?
Yep, that would be great, please.
Okay, so we'll start over with Jeff.
Oh, good. First, Jeff Winkleman, Lumen. Kevin Newton, Lumen. Greg Brooks, Data Mark Technologies.
Jeff Tucker, Motorola.
Carl Stevens, Garfield 911.
Andrew Dameron, Denver 911.
Jim Colorado County.
Ken Winward with Hexagon.
Justin Kirkland, Gypsum Fire Protection District, and also president of CCNC.
Michael Berry, Summit County.
And Jennifer's here. We have Jill in the back who did all the work for the hosting, so thank you, Jill.
Okay, perfect. Thank you again for everybody there in person and those on.
Let me see if I can mute Claire. There we go.
You.
Go ahead, Tina.
All right, we'll go ahead and move on to the next item on the agenda, the approval of the minutes. Hopefully, everybody has had a chance to review those from the May 9th meeting. Any discussion or questions on those? Okay,
This is
I'll
Carl.
just,
Approved.
This is Andrew, I second.
okay, all in favor of accepting the minutes from the May 9th meeting, say aye.
Aye.
All opposed, say
Aye.
aye. Perfect. Motion passes and minutes are approved as written. All right, next on the agenda, we have a presentation coming up from the Colorado Training Standards Institute. CJ, I'll go ahead and turn it over to you.
Probably trying to get off mute.
How is that? Any better?
Yes.
Excellent. Okay. Apologies for that. Technology. Wonderful. Thank you for your time. I wanted to give a brief overview of the Colorado Training Standards Institute. I was lucky enough to go ahead and do a kind of informal presentation at the APCO NINA 911 conference that we had not too long ago, and just kind of touch on the Colorado Training Standards Institute, what we do, who we are. Some of you may or may not be familiar with us when we were the committee as opposed to an institute. So speaking with Jennifer and the rest of the committee, we thought it would be, or I apologize, the institute would be a good idea just to give an overhead as far as what we're all about, what we're doing, and what we're trying to accomplish. So hopefully I will be able to share my screen. Sharing is not turned on. If I could request, I have a small PowerPoint.
You should be able to share. Now.
Here we go. Can everyone see that? Oh, here we go. Oops, if you hit share. There we go. Apologies again. All right. Just some of the topics I'll just cover briefly today, or just kind of like the conception of the training standards, what membership entails, how we develop our course, how we go about selecting our instructors, touch on the classes, and also funding and future planning for our institute. So in 2010, agencies from across the states, I believe it was either at an APCO or a NINA conference, decided that looking around the state, there was no true formal set of standards for training within the state. Many states were coming up either through legislative means or by the state or a state authority board. We're beginning to come up with state standards. We thought it a good idea as the group of collective trainers to get together and say, hey, we should probably get ahead of this, because eventually the state may come looking to set a state standard for what telecommunicator training would look like across the state. With that, we were able to utilize the 911 Resource Center to kind of help push this along, and in a sense, just help develop these training standards for the state of Colorado. Looking into it, at the time the group began, there was about 26 states across the nation that had installed a standard for training through legislative requirements. And looking at it briefly, I believe it's around 30 now, but that number is steadily and slowly climbing. Membership of the group, it's made up of PSAP representatives. It's made up of telecommunicators for telecommunicators. We do have a set of bylaws. Bylaws were, again, formulated and brought up in the 2010 group on through the years. We do have monthly meetings. They were in person. We also, well, they were in person. Currently, there are a lot of webcast Zoom calls, but the hope is that eventually, as we get the group rolling back together, that we will have more in-person meetings. It's just beneficial to meet in person, as we all know. The course development, we came up with a very generalized curriculum, looking at our own in-house training that we had, examples from APCO, examples from NINA, examples from other training programs. We came up with a very generic training program. We wanted to do a 40-hour curriculum because that was seen as the standard. We also went through it to make sure that we were hitting the minimum training standards that were set. So we came up with lesson plans, the lessons. We also came up with PowerPoints and then testing, just to make sure that the retention of the materials was being retained. We did go as the trainers came up with these modules, we made a decision as far as what curriculum would be best. We did go through an approval process. So we would present all the documentation and information to the group. The group would go through it and vet it, make suggestions, recommendations, if it was too small, too short, or too large, and made the proper adjustments from there. And then ultimately, it was voted on by the group, and there was a quorum process. There is a quorum process in place in order to have the modules agreed upon. These were the modules that were agreed upon and currently in use. You'll see that we've pretty much, it's a very 30,000-foot view as far as what we do cover, but we feel that it is very thorough and what a majority of a 40-hour basic telecommunicator course would entail. We do have people that volunteer their time in order to be instructors on the materials. Sometimes we look out and we have an individual who has enough time and backing from their center to enable that individual to teach across multiple days. Normally it's either 4 10-hour or 5/8 across a week when we do instruct on the materials. How the instructors are selected is they actually go through an application process. So you actually apply because we really wanted people that were vested in teaching the materials. They were required to present on a topic of their choice, and then after the presentation, there was an interview that was conducted. Presentation, obviously, to see if an individual could handle teaching. You know, if they were a CTO, that's even better. And then they were interviewed to basically ask why do you want to be a trainer? Why do you want to go through this process? We have had 4 classes that have been offered. Our very first one was in the metro area, and that was in Arvada. We did offer a second class on the western slope. However, due to low numbers, we did not facilitate that. And I believe at the time we were trying to look at or come up with at least a minimum amount of people that were interested and signed up for the course in order to have individuals take time away from their centers or volunteer their time in order to make it worthwhile. We did have a third class in Weld County. So And our fourth class, again, was offered in the Western Slope, and that was in Delta, and that was successfully did come about. So we were happy with that one. So just talking about class location and materials, future classes, normally, since we have participation from PSAPs, they will come about and either request that the course be taught to their telecommunicators, or getting the word out of mouth and eventually coming back to us as far as agencies that would be interested in having us put on the course for them. The materials, they're all, I apologize. The material updates. So when instructing on the material, we do make sure that they're reviewed. We do make sure that they're relevant. And actually, we have gotten the group back together after a long pause through COVID. And we are currently in that process now. Since it had been a few years since we had put the material together and taught on it, we do know that technology is steadily advancing forward, and we're making sure that the materials are relevant, prudent, and up to date. So as we go through that process, we're currently in it now, and we're making corrections. And again, that material is being brought up during the meetings, gone over recommendations, and then ultimately a quorum vote to put it in place. It has been taking place. So the class of the cost is free. Normally, departments will need to cover the employee's time and their travel costs, and then also any materials that need to be printed to be taken to the class. And that's normally a 40-hour basic telecommunicator course type of material. So there would be the modules that the employee coming to the course would be asked to bring with them. I know a couple of the hosting sites were generous enough to go ahead and donate materials if that individual agency or that individual or the agency could provide that. But the costs of these courses are 100% free. So funding, currently we're self-funded. We do have a nonprofit status currently. As we move forward, we are looking for future funding options. Back a few years ago, we were looking at a 911 surcharge potentially, or any kind of federal grant or private foundations, either or business or corporate support. So as we all know, there's a lot of legislature in place right now, which could help the funding of the Institute. Again, this is 100% voluntary. The people that participate and train, this is all free of charge. They do it out of the kindness of either their departments helping to cover that time, or they volunteer without pay. Again, it's normally just the departments are volunteering time or the space to hold the classes, and maybe putting out a flyer or two. And currently we're in the process of to get more interest in the group. A flyer will be coming out here soon. We were able to put one out and just get the word out again, because a lot of people were familiar with us, but then COVID hit, and now we're trying to get the band back together, as we like to say. So with the materials, we had currently we're offering and providing the free course. The thought is eventually we want to get the word out more and more, and how do we do that, or how can we get this information out to the public? Currently, all this information and the courses and the modules are free. There is a waiver to kind of sign off if you'd like to access the material or have that for yourself. We do provide that free of charge. There's no charge. And if a center would like to train their own center on materials, they're allowed to do that. It's just they have to sign a waiver, just basically recognizing that it was where the material came from, and that it's being provided free of charge, and that you won't try to do this monetarily or try to get paid for doing so. So. We are looking at, as I said before, we're looking at legislation as far as like a standardized training program across the state of Colorado. We also agreed that if a center has like already taken or already provides some type of basic telecommunicator course within their center, the APCO, the NINA, any like PowerPhone, that would be looked at as yes, that is filling the need in the event that Colorado comes across with a requirement for a standardized training program. And our hope is that this program will also help supplement it for those who cannot afford to pay for their telecommunicators in order to get a basic telecommunicator course. So part of the reason for this presentation is to one, kind of get the word out and to get more participation from the PSAPs, because ultimately we feel like, this is by telecommunicators for telecommunicators. So we don't want to be a solo voice saying that this is the way it should be. We really like to get participation and feedback from all the PSAPs throughout the state. And we realize we're pretty good on hitting some of those major metropolitan areas and some of the larger counties. However, there are still a few stragglers and outliers, which we've seen minimal to no participation of. So we're trying to get the word back out there again, making them aware of our monthly meetings, seeing if the individuals would like to be instructors with us. And so we do have a flyer, currently working through the long list of addressing envelopes, but you should be seeing that within your PSAP within the next week or two at the latest. So with that, I'd like to thank you all for your time, and I'd like to see if anybody has any questions.
Thank you, CJ. I don't have a question. Daryl has a question.
Not a question. I just wanted to fill in a little information. Talk about the number of states that have statewide 911 training standards. This includes voluntary, so it's not all mandatory. But according to 911.gov, they have a map up, and in 2022, there were 8 states left that had no statewide training standards, including Colorado, and 3 states that didn't respond. So it's somewhere between 8 and 11 states that don't have any training standards. So it's a shrinking minority.
So one of the reasons that we are sending out the flyer that CJ talked about and talking about it here in the task force is that at the managers directors roundtable at the NINA APCO conference this year, a lot of the people in this room and in this meeting, we talked about training standards, and there's clearly a desire for training standards in the state, but there is obviously a desire not to have that necessarily in legislation or to have it done mandatory. And so the question was put to that group, where should this conversation continue? And that was determined to be the Training Standards Institute. So we'll be talking in the Training Standards Institute about in meetings going forward about training standards in Colorado. What should they look like? How should they be codified? Who should be keeping track of that when they get into place, and is there certification, and so on and so forth. So the Training Standards Institute has been tasked with that conversation, and we would like to get as many PSAPs in Colorado as possible to be participating in those conversations so that we can have everyone's voice heard in the setting of those standards and how we move forward in Colorado with training standards, at this point voluntary. So if anybody else is in that meeting at the NINA APCO conference, I invite you to chime in, or if anybody has thoughts or questions for CJ. And CJ, thanks so much for presenting to us.
Thanks, Jennifer. Thanks, CJ. Great presentation. Does anybody else have any questions or comments? Well, thank you, CJ. I'm with Weld County and I'll make sure that my training manager reaches out because we want to make sure that we're involved. So we'll be doing that. Of
Appreciate that. Thank you. Thank you so much for your time.
course, thank you again. All right, we will move on to standing reports. Just a reminder, we do not read these throughout the meeting, but if you have any items to add or any questions for the chair, please ask those during this portion. We will start with the PUC staff update. Jennifer?
Let's see, we've had an awful lot of things going on, so I put updates for our 3 proceedings in there, and I'm happy to take questions. Daryl and I did attend the NASMA meeting ahead of Nina, and I would like to call out Daryl. He is the 2024-2025 NASMA president, so congratulations to Daryl, and thank you. I know he's going to represent Colorado well. We've been having a lot of questions about the enterprise board creation. So the state has a website already in place that's used for people to apply for any governor appointed positions. And as soon as they have that website updated for the enterprise board, we will spread the word far and wide so that you can get your nominations in. We had a great lunch and learn in June with Denver 911 presenting with Spider Tech. So there's a link there for you to watch it. And we've got prepaid and surcharge distribution information listed there. So if anybody has any questions, I'm happy to answer.
Thanks,
Thank you,
Jennifer.
Tina.
No problem. All right, on to basic emergency service provider, Lumen.
Hi, this is Tim. I don't have anything to add to what I put in the report.
Okay, anybody have any questions for Lumen? All right, BSP report, Intrado.
Intrado does not have anything to add today. Thank you.
Okay, any questions for Intrado? Okay. On to the bylaws committee, Kimberly.
We have no bylaws requested, no changes.
Okay, thank you. Anybody have anything for Kimberly or the committee? All righty, legislative committee, Jackie.
Jackie was not going to be able to be here today, Tina.
Okay, no problem. Does anybody have any questions that I can pass on to her? Okay.
Sorry, this is Jeremy. Just had a problem getting off mute. How do I join the legislative committee?
I can put you on the list, Jeremy.
Awesome, thank you.
Thanks, Jennifer. 988 is next. Jennifer, were they able to join us?
So Kelly emailed and she said that she has a conflicting meeting and would be able to join at 11. So hopefully we'll still be going at 11 and she's happy to answer questions about what's going on with the 988 program.
Okay, perfect. We'll come back to that at 11. Equal Access Committee, Holly.
So this is Sarah. I think Holly might be out for this meeting today. So I'm speaking on behalf of Shirley's for proxy. And just as it says, we took a break for the May and June meetings. We're going to reconvene this month for July, go back over our town hall information, and then hopefully have Dub host a presentation for us and just see where we want to take this committee for the next step.
Perfect. Any questions for Sarah? Okay. Outage committee, I don't have anything to add other than what is on there. Daryl, do you have anything you'd like to add?
I added some information at your request, Tina, there about what commission staff is working on from its investigations, about how many current investigations are active, as well as the number of meetings we've had since our last task force meeting. And there's also a link that I would like to point out to people at the end of that report that will take you to the page on the 911 program website that has a current list. So if anybody's ever wants to look at what active investigations are ongoing, that's the place that you would go to look at them.
Great, thanks, Daryl. Does anybody have any questions for Daryl? Okay, prepaid and collections committee. I know Jackie's not here. Does anybody have any questions for that group?
You know, if it's all right with you, I'd like to ask Kimberly to kind of go over it a little bit in detail since we have a good group here. This is a good opportunity to get the word out if Kimberly doesn't mind.
I don't mind. So this is Kimberly from a prepaid collections committee. We did meet to talk about how prepaid wireless surcharge is distributed throughout the state. And from a historical perspective, when this bill was first adopted, this was our first state initiative from a surcharge perspective. And so the model of using wireless call volume was prior to us having SIP sessions, and SIP sessions being calculated for distribution. So what we looked at and what we discussed at our last meeting was, should we, and that's the question, should we look at distributing the prepaid surcharge via SIP session instead of wireless call volume? The problem with wireless call volume has just been the numbers. It's gathering those numbers every year and making sure that 2 + 2 always equals 4. How are those numbers calculated? Where are they calculated at? And then coming up with an algorithm for the surcharge amounts. So the meeting is recorded. We have a very high-level draft spreadsheet. It's just a draft of a spreadsheet, crunching numbers and taking a look at the impact and what that would look like if we changed to a SIP session model for the prepaid. So early on, and we would love to have more discussions about this and get feedback. So I encourage people to take a look at that YouTube video, to take a look at the spreadsheet, and then to just have the conversation, reach out either to Jackie and ask questions. And then that way we can circle back to the task force and the legislative committee of the task force if we feel like this is something that should move forward. Any questions on that? Great, thank you.
Thanks, Kimberly. On to the EZNet users group, Kathy.
Good morning, everybody. Unfortunately, the report that I have in here is over a month old. Our last EZNet users group meeting was yesterday, and I have not had a chance to put in or update the report. We did have a good meeting yesterday. There was some concerns brought forth in regards to the NOC and actually some issues that were specific to the Arapahoe County agencies. And I felt that the conversation was good during the meeting. I really want to put together the report like I do so that I can put it out for everybody. And also yesterday at 1 o'clock, we had a special meeting, which was also recorded and should be on the channel. And then this was to address the Pitkin and Vale routing issue that has plagued them for 2 to 3 years. That meeting we also felt went very well, and we are hopeful that there is going to be a solution for both of those agencies as we're moving forward, and that will continue to be an agenda item on the EZNet users group every month until we know that we have a resolution to that particular issue. That's really all that I have right now for the EZNet users group, but if anybody has any questions, feel free to ask.
Kathy, this is Jennifer. Do you want Jeff and Kevin, who are in the room, to talk briefly about the camera trunk issue?
Sure.
Yesterday, since we have a wider group here. You're up.
I'm assuming you're talking about the dialability of those numbers?
Yeah.
Calls that are coming, yeah. We have the ability, I know it's been a concern discussed in the past. The spam calls and robocalls that are coming in because they're utilizing the routing DN or the routing, what's DN simple? Directory number. It was the number that was designated for the camera trucks when they were in use. Those are still in place today and they're used primarily for testing. They don't have to be, excuse me, put in place. So we have the ability to be, to have those removed and non-dialable. So we need to be able to identify if those numbers are being used. We've heard in some cases they're still being used for like alarm lines. We have to make sure they aren't being used and actual transfers are set up properly. And we could actually go through the process of removing those, the ability to have them dialable. So we'll have to outline, I know Jennifer and I talked about outlining steps to be able to identify if they're being used or not, and a couple of other key points before we go through with that. But we want to at least open that up for a possibility, because I know it's been a concern and discussion in the past. Any questions or comments?
Kimberly, go ahead.
Thanks, Tina. So I do have a question, and we were surprised that all of our 48 911 sessions were still dialable, and we would like to have that change, but I did ask if CenturyLink would put in writing that nothing in our call flow would be impacted when those are disabled. I mean, obviously what you just covered is if somehow those numbers got out and were given to alarm company to call 911 to dial a 10-digit old camera trunk number. But our concern is with our EZNet that there's some other purpose for keeping those extensions dialable. So is CenturyLink able to put that in writing back? Because I asked for that several weeks ago and Tracy was circling the wagons, she said, to validate that.
We can check and see. Well, she's out of the country right now. She's on vacation, so I'll double check with her when she gets back. On that ability to actually put in writing, unless if Tim's still on, if you can talk to that. I can't say if we can put it in writing or not. There's still things that we need to check on, so.
Well, I think it's critical for 911 directors before they make a decision to change a number from being dialable outside of what you've already identified if they were given out for people to call in and reach 911, which hopefully that hasn't been practiced in the past. But again, our concern is that there's some other reason, purpose that they are in the EZNet deployment, and we don't want to break anything in a call flow by making them inactive. We definitely need to fix our spam calls. I mean, we had 150 spam calls at one of my PSAPs within a week's period of time. So it's a significant problem for us. And so we want that change, but I just need some assurances that there's no other behind the scenes that we're just not aware of that will be impacted in our EZNet.
Okay, I will get with Tracy when she returns and find out where that's at.
Matt?
Thank you. In addition to that concern, do you and Kevin have a better, or someone else have a better way of ensuring that we can find out what all of those DNs are? You two might remember, this is Matt with METSA. You might remember Alex and I working with you earlier this year to try to ensure that we were aware of what each of those phone numbers were because of some alley issues we were having. We just discovered a new one that wasn't in the list just this week. So we're looking for a better way to make sure that we're aware of all of those DNs.
Well, I don't want to publish for a whole state because I don't want those numbers to be dialed by anybody. So
Right.
it's easy, really easy individually to pull up all your direct numbers for your PSAP. If you reach out to Jeff here, we can distribute that to anybody who wants your phone numbers.
We're working through the logistics on what this would look like. There's still a few things that we need to do. But that was one of them that we discussed, is we want to make sure that we have all the route and DN numbers listed. So that's a big piece of it, that we're not missing anything. Excuse me.
Okay, we'll be in touch. Thanks.
All right, does anybody else, is it Michelle? This is Michelle Singer Nelson. I'm with the AG's office, and I represent the Utility Consumer Advocates Office typically at PUC proceedings, but my job also involves working on anti-robocalling task forces, nationwide anti-robocalling task forces. So one of the obviously one of the big concerns that all the AG's offices have is the effect of robocalling on 911 services. So we don't have to go into it at this point in time, but could someone, can you give me a name that I can talk to with where I can get a little bit more detail on exactly what's happening? Either with robocalling related to the use of outbound TNs, and then also any inbound calls that 911 centers are getting that are spam calls. I would just love to learn more details about that so we can include that in our investigations. Yeah, thank you, Michelle. Kimberly, would you be okay if we connected you with Michelle?
Absolutely, Michelle, I can run a report and show you all the inbound spam calls we received, and I can do that year to date.
Oh, that would be awesome.
Yeah,
Thank
happy
you.
to. You're welcome. And it'll just be for Larimer and Jackson counties.
Well, at least that'll give us an example.
You bet.
Thank you. Great, thank you so much. Does anybody else have anything for the EZNet user group? Any questions? Okay, on to GIS committee. Matt.
Good morning. Nothing to add.
Okay, any questions for the GIS committee or Matt? Okay. Colorado Public Safety Broadband update. Is Kristen on? Okay. PSCS, Denny?
Nothing additional to add.
Okay, thank you. A SWIC update, Amanda?
I have nothing to add, thank you.
Okay, does anybody have any questions for Amanda? All right, next is Division of Fire Prevention and Control, Connie.
I have nothing to add.
And Colorado 911 Resource Center update, also Connie.
And nothing to add to that.
Okay, any questions for Connie? All right. Rapid SOS update, Karen?
We have a few updates here. One is just being a little bit nerdy with data and sharing some cool visuals on what happened for the July 4th. Obviously, it was very busy for everyone across the country. And we just wanted to share with everyone some insights that we can glean from the calls that we see, majority of them being wireless calls. However, now we also, with premium being rolled out, have access to some of the landline calls too. So like 114% spike in call volume compared to baseline, and 292,000 calls between 7 p.m. Eastern and 5 a.m. Eastern. So if you want to get nerdy, see some cool stuff, you all live this, you know it. A few exciting things that I added in the report was the announcement of Apple Emergency SOS Live Video. That will be coming this fall with iOS 18, and you will be able to request callers to share live video. It is really an embedded workflow on the iOS device without a link to click. That will be available in Rapid SOS SOS Unite at no cost, as well as the Google RCS to be released later this year as well. This is not a replacement of text to 911. This is more of a text with 911 and the ability to communicate for states like Colorado, who has text to 911 almost everywhere. It could be a backup if you want it, but it doesn't change anything that you have to do today. It's really more to help fill the gap for agencies that do not have text to 911. Folks will still receive that bounce back message, but the 911 center will have the ability to click a button and start to communicate with that person. We just wanted to make sure that it was very clearly stated this is not a replacement. And then in case you missed it, Rapid SOS portal is now Rapid SOS Unite. For more information, we wanted to make sure everyone had access to the Innovation Day video, which I've linked here as well.
Great, thank you. Anybody have any questions? Okay. On to the Colorado Council of Authorities CCOA update. Kimberly?
So I don't have anything different than what I added in my report, but I did want to just highlight the fact that we are holding a statewide 911 Authority Board meeting. And so this is not just for the CCOA members, which we have 22 members. This is for all of the 911 Authority Boards across the state. And historically, LEDA has done this a handful of times, and they've been great discussions. And so the CCOA wanted to host another statewide authority board meeting, and Motorola is our sponsor for that meeting, which is fantastic. It's going to be on Tuesday, September 24th, 9 to 2 at their Westminster location. So if you are interested in attending, and that we would love to have 100% of the authority boards attend this meeting. So please just email me and we'll get you on the RSVP list.
Great, thanks, Kimberly. Anybody have any questions?
Kimberly, this is Karen. Will that be an open meeting as well?
It will be an open meeting.
Okay, thank you.
Mm-hmm.
Want a hotel room, the Westin have the best rates. There, and just if you do the normal rates are better than the government rates. For that matter. Yeah.
All right. All right, so we're finished with our reports. On to old business. We didn't have anything showing in old business. Is there anything that we need to discuss that was from the last meeting? Okay, we'll go ahead and move on to new business. The first item is voting members and attendance. So as you all know, the bylaws state that if you have a member who misses 2 or more meetings during the calendar year, it does automatically remove them from their voting position on the task force. We have 3 members who were in this position who have expressed interest in being voted back onto the task force. It's Jody Chin, Felicia Librand, and Ronnie McGruder. And as I said, they did express interest to Jennifer to rejoin the task force. If everybody's good with that, I would just need someone to be willing to put forward a motion to vote them back into their previous positions.
This is Jeremy Schubach. I'll make that motion.
This is Matt. I'll second.
Okay, after the second, all in favor of voting Jody Chin, Felicia Librand, and Ronnie McGruder back onto the task force, say aye.
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 All opposed, same sign. All right, great. Thank you so much. The next item on here is 911 telecommunicator reclassification. Jennifer.
Thanks, Tina. So the Office of Management and Budget is starting their 10-year cycle again of reconsidering job classifications. And they do that, they start gathering data a couple of years in advance, and they've started that data gathering process. As part of that data gathering process, they can reach out to any PSAP in the country and ask for job descriptions. That's the data that they primarily use to consider whether or not to reclassify telecommunicators. So that means it's really, really important that all of our PSAPs have updated job descriptions that talk specifically about what our telecommunicators do. And they're looking for things like EMD usage or life-saving technology or monitoring cameras or that kind of thing. What we're looking for in the job descriptions are specific skill sets that 911 telecommunicators have that are not solely clerical. So, the 911, National 911 program actually has a really good resource for this. I'm gonna pull it up and just kind of show it. But they have some sample, job descriptions. Let's see if it's in here or if it's somewhere else. They have to, oh, here we go. So in current projects, yeah, it's on the screen. On 911.gov, it has telecommunicator job reclassification, and it has guidance on developing a telecommunicator job description. It has information on training programs, operational integration of technology, and a toolkit for updating your job description. So if you are interested in updating your job description and you don't know where to start, this is a great place to start. We also at the Resource Center, well, Connie has at the Resource Center some job descriptions, sample job descriptions that were developed here in Colorado, and we can, she can get those out to you as well. So this is a call to action for updating your job descriptions, which I know is kind of a tedious process sometimes, especially if you have to go through HR or your legal advice process. But it's super important that we all have updated job descriptions because again, the OMB can reach out to any PSAP at any time and ask for that. So we're looking to boost that data in that way. Michael, you have your hand up.
Yeah, Jennifer, I heard a lot about this at the National NENA conference a couple weeks ago, but what I hadn't heard about as far as OMB, when they're doing their research and the data points that they're looking for, are they also talking to, those agencies that have government oversight of the various areas of the 911 industry, such as FCC, NHTSA, NTIA? Are they interacting and communicating with industry organizations such as NENA and APCO? And is there any data points that they'll be looking at for state legislation of the many states that have already indoctrinated through legislation on this issue?
No, I know that NENA and APCO have been in contact with them, but I don't know the answer to the rest of that question. Does anybody else? I heard a lot about it at the conference too, but I didn't hear anything that specifically addresses that. Did anybody else?
This is Karen. I'm happy to take that back to Nina and ask Brian if they do.
That would be
That'd
great.
be great.
Does anybody else have any questions or comments?
One other thing to add, just yesterday, the House committee that was considering the 911 Saves Act that would have directed OMB to change the classification was marked up and passed in a slightly modified form. The modified form being, instead of directing the OMB to change the classification, it asked the director of OMB to consider changing the classification. And if they choose not to, they have to report back to Congress as to why they didn't. So APCO and NENA actually released a joint statement on that action yesterday, which they both posted to their website. It's still a little bit of progress forward, and it still brings awareness to the OMB about the critical issue, but it removes that direction from the act. So a little less strength there. And that's all I had.
Also, Shannon put in the chat that July 17th, there's a webinar through APCO regarding the reclassification. So just for information, if you guys want to sign up for that. All right, a formal and informal complaint process, Daryl.
Hello, thank you. Let's see if I can get my camera to turn on. There we go. So I just wanted to address some comments that I've been hearing, a couple of comments that I've heard about the commission not enforcing or taking action regarding enforcement of the commission's 911 rules or the requirements of the tariff. And I wanted to let you all know that we hear you. And I wanted to talk about a couple of different avenues that can be taken or potentially could be taken in the future One is the 911 outage investigation process that was established in the last rulemaking. And you can find that process in Rule 2143K. And those are the informal investigations the commission staff conducts of 911 outages or basic emergency service outages. The outcome of those investigations are filed in a proceeding, which means that it's part of the public record and is part of things that the commission can consider in future actions. And when discussing potential enforcement actions internally, the first thing that we do is we talk to the Attorney General's office to make sure that we have a good case and that we have a good legal argument for what it is that we are asserting. And when we started talking to the Attorney General's office following the implementation of the investigation process, it was their opinion that we needed to clarify some of those rules before we could enforce them. And that's why we did a 911 rule clarification proceeding this year, which is still ongoing, and that some exceptions have been filed in that proceeding. So those will need to be addressed before that ruling can be finalized and before those changes to the rules can be made effective. But that is a potential avenue for future action that would not require any additional action on behalf of the local 911 authorities or by the task force or by anybody else, because the information necessary to take action would potentially already be in those investigation forms, which are filed in the miscellaneous proceeding for the investigations. However, the other avenue is that local 911 authorities or the task force or CCOA or anybody with the permission of the local agencies who are affected by a potential rule violation or by a potential or alleged failure to meet the requirements of the tariff can file a formal or informal complaint with the commission. And we see very few of those. And I do want to acknowledge that we received one last week. I will be responding to that by close of business tomorrow at the latest. So I'm sorry it's taken a little bit to get to it, but we will be responding to that shortly. But I think some people have maybe a little bit of an unrealistic expectation that if Jennifer and I know about a problem, then the commission should take action on that problem. And that's just not how it works with a regulatory body. The information that the commission may take action on has to be in the public record. It has to be in a proceeding before the commission before they can act on it. And the easiest way to do that is to file it with the commission as a complaint. So one of the things that I'm planning on doing, I'm going to hopefully do this by the end of the month, is I'm going to record basically an instructional video on how to file an informal complaint and how to file a formal complaint, what the benefits of each are and what the potential outcomes of each are. And we will be putting that up on the 911 program website. And when it is available, I will also be sending out a link to the task force so that you have that. I think it is very important to make sure that the commission is aware of allegations or concerns about non-compliance with rules and non-compliance with provisions in the tariff. And I can't go so far as to encourage people to file complaints, but if you have complaints and you don't know how to get those in front of the commission, this will help you do that. So I just wanted to let people know that that's coming, and that if there are potential rule violations following the finalization of the new 911 outage rules through that clarification proceeding, there may be additional action that's taken even without additional requests or information from the local 911 community. So if anybody has any questions for me, I'm happy to answer that. But otherwise, I just wanted to let you know that that's coming, and then I wanted to provide that information to the community so that you know how to engage in that process.
Kimberly, go ahead.
Hey, Daryl, thanks for that. I just want to make sure I understand what I heard correctly. So these are all hypotheticals, not to get anyone into going down a rabbit hole of anything, but hypothetically, if the commission staff is aware of a violation that's in the tariff from a 911 provider or something that's not being followed that's outlined in the rules. So the part of the 911 network that is regulated, tariffed under the Public Utilities Commission. So if there is something that is going on in that particular part of the network and PUC staff is aware of that, so through an outage investigation or what other means may happen, what you're stating is that PUC staff cannot open an investigation on their own accord, that a 911 authority has to open that investigation?
What I'm saying is that the information has to be in a proceeding before the commission.
But
so you mentioned just
sorry.
a moment. So you mentioned the outage investigations. So that is an example of where we could move to action without a complaint being filed by a local agency because there's already information in a proceeding before the commission. The reason why we haven't so far is because when we talked to the Attorney General's office, they told us that we needed to clean up those 911 outage rules before we moved to enforcement. But that is a possibility in the future when those rules are finalized. But if there's something else that is not in a public proceeding before the commission, it's not in the public record, then we need to have a way to get it into the public record before the commission can take action on it. And as the customers of the tariff, it is more difficult for commission staff to make a complaint on behalf of customers who are not officially complaining to the commission. It is much easier to take action if the customer comes forward and says, this is what happened, this is why we think it violates the rules, this is what we would like the commission to do about it. And that's what a formal complaint is. An informal complaint allows us to compel responses from the company, but will have potentially different outcomes. And it's not one or the other. You can start with an informal complaint and move to a formal complaint later as well. And those will be the types of things that I explain and go through in the instructional video.
So a follow-up question, can PUC staff open a proceeding?
PUC staff can open a proceeding if it has sufficient documentation of the problem. And the problem is that since we're not the customer, it's much more difficult for us to obtain that documentation. And if there is a customer who is making an allegation of a failure to follow rules, it would be much better for that customer, being the 911 authority, to make the complaint.
So my opinion and my experience in this environment is there's a lot that happens in the 911 network as it pertains to the part of the network that is under PUC regulations. And it is, I think, very difficult for the 911 body in general, whether it's an authority or PSAP, to really have all the pieces of the puzzle and mesh that together to understand, was it in compliant? Was it out of compliant? Did the tariff call for something different on an SLA? Is there an SLA, et cetera? It is very, very complicated. And so, and it's costly, right? You have to know that there was a violation or a problem or something that, that you're due credits back, for example, for a lack of service. I mean, those are just the pieces that are not always glaring for somebody when they have an outage, an issue, or another problem. And then you have the legal component. Not everybody has dedicated staff, dedicated legal counsel, etc. So I think a lot of our problems are not getting to that level of an informal, formal complaint because of those factors. And if the PUC is regulating the 911 core network that's provided by the BES, I could be wrong, but I would go out on a limb to say I think a lot of 911 authorities and boards and 911 personnel kind of defer to you and Jennifer as enforcement of that part that is regulated and under the tariff, to hold the vendor accountable for that service delivery, versus saying, well, first there has to be somebody who's going to be upset to, pull all those pieces together. So almost as if you guys are in the driver's seat because you have the rules, the tariff, and all the pieces of those puzzles that a 911 PSAP director or authority board may not have. So I think that your discussion about all of that is going to be helpful, but I do think that I know for us and just hearing from my peers around the state, having PUC drive a little bit, some of those concerns would be helpful.
I appreciate that. I think, and that's kind of what I was getting at with my reference to some unrealistic expectations. The PUC is a regulatory body and all of our proceedings are quasi-judicial, which means that we are less the police and more the court. I think there's I see the strong desire to have PUC staff act as the advocate, but our job is not necessarily to advocate for one party or the other. Our job is to adjudicate and help the commission adjudicate issues when they come before the commission. So while I see the desire to have commission staff be in the driver's seat, you as the customers have to be in the driver's seat. You are the customers. And if you don't believe that you are being treated fairly by the company under the rules or under the tariff, it is up to the customers to let us know what that is. And part of the issue that we have is because Jennifer and I are so involved in 911 compared to how PUC staff are involved in other industries. You've got no other industry that the PUC regulates where staff is in constant discussions with the parties like we are in 911. I think there is an expectation that we will be more proactive as an advocate for the 911 authorities when that's really not our role. So what I would say is I want to empower you as the customers to put yourselves in the driver's seat and to come forward and advocate for yourselves. I do understand that it is costly, which is why I'm hoping that the 911 task force can help with that, or potentially CCOA can help with that, or potentially some of the larger 911 authorities that have full-time counsel can assist the smaller authorities with that. Or they can start with an informal complaint, which really does not require them to have any legal counsel to assist them. But yeah, and hopefully the informational video will help with that. The other thing I wanted to mention is that the commission also relies on the task force as well as the EZNet users group to inform it when there are issues, and that is another way that things can potentially get into a formal proceeding, because there is a proceeding where the task force can file documents, letters, other types of information with the task force. So I think that's something that maybe the task force or the EZNet users group should look at in the future, because one of the roles of the EZNet users group is to work out problems before they become complaints. And if you're working at, if the EZNet users group is trying to work on something and it's not coming to a resolution, and the EZNet users group decides that this is something that the commission should get involved in, then I think it's up to the 911 advisory task force, because that's what the task force is an advisory body to the commission, should let us know. I hope that helps.
Thanks, Daryl. Thanks, Kimberly. Does anybody else have any questions or comments? Okay, that's all of our, yep, no problem. That's all of our.
We do. Oh, Tina, before you close, I saw Kelly has joined, and I know they wanted to also provide an update.
Yep, I saw her. Kelly, are you ready?
Yeah, absolutely. Good afternoon, everybody. My name is Kelly Bowman. I am the 988 Enterprise and Crisis Line Program Manager with the Behavioral Health Administration. Just a couple of quick updates, because I have some more important guests that I want to introduce to all of you. So I believe one of the last updates that I provided a few months ago was that the state was in the process of reprocuring both 988 and our statewide crisis line. That process has now wrapped up, and we have a new vendor that we're very, very excited to work with for the next several years in Solari. And so This has a direct impact on our 988 on the PSAPs. We know that several PSAPs have already been transferring contacts directly to Rocky Mountain Crisis Partners. Solari is going to very successfully be able to continue this work. They have success with working with PSAPs in 2 other states outside of Colorado. And so in just a couple of moments, we're going to have the team introduce themselves and just talk a little bit about what they will be bringing to Colorado. A couple other pieces that we wanted to share. I believe you all probably received an email in the last 48 hours. We have recently launched our 988 website. This is something that has been 2 years in development with a lot of research, Colorado-based research to design this in a way that is very user-friendly to meet the needs of folks in Colorado. So that is an opportunity for you all to share that with your community partners. You can order materials. You can request to have one of our staff come and speak to your agency directly, to community partners. And so that is something we're really excited about. That has been a 2-year labor of love that we're very happy to have up and running. Additionally, some of the exciting updates that we have, we're also going to be hosting a webinar on the 31st to talk about 988 as a kind of a broad overview, what's happening with 988, a little bit about the future of Colorado Crisis Services, and answer any community-based questions. So I will drop a link in the chat that has access to all of that information. But with that, I actually want to yield my time and turn it over to our partners at Solari to introduce themselves. I believe Cassie and Justin are on.
Yes, good morning. My name is Justin Chase, and I am the CEO for Solari. Thrilled to be here today. Thrilled to work with all of you and the state partners and collaborators with regards to crisis care and service delivery. I've been with the organization in this role just past 10 years, and I'm a social worker by trade, but again, I've been in administrative roles for a number of years. So I'd love to have Cassie chime in and introduce herself.
Sure. I'm Cassie Villegas. I'm the Chief of Crisis Services here at Solari. I've been with the company for almost 11 years now, but working in behavioral health my whole adult life. So I'm a licensed counselor by background. I've been working over compliance as a forensic specialty. So I work a lot with law enforcement in my previous role as a therapist as well. But happy to be here and overseeing this transition. I currently oversee all of our emergency response coordination here in Arizona and Oklahoma, as well as our crisis mobile dispatch, our crisis teams, our peer support teams here in Arizona, Oklahoma, and Colorado. And then we actually also have Jess, who we brought, because she oversees the law enforcement collaboration teams directly. So Jess, do you want to introduce yourself?
Sure. My name is Jess Howard. I'm one of the directors of Contact Center Operations and Clinical Services at Solari. I am also a licensed social worker, but I do oversee law enforcement collaboration and our dispatch department in Arizona. And we are just really excited to start working with you guys and see how we can collaborate.
So just a high level, the Solari, we've been around since 2007. We were founded by a group of crisis providers in the Phoenix metro area to create a hub network for the crisis contact center, as well as mobile crisis dispatch and facility coordination. Quickly, we've over time learned that the data undertones and the technology systems required to do that successfully has a high value, and partnership and collaboration has been really critical. We've been involved, I've been involved with CIT training in Arizona as well as in Oklahoma, but in Arizona since 2003, and the adoption of the Memphis model. But we learned over the years that there was a big gap in where we were trying to engage with regards to coordination with first responders, and especially focused around law enforcement, is the CIT efforts are really targeted to once an officer or first responder is on scene, then diverting and coordinating with the behavioral health system and the crisis system. We're trying to get upstream from that, and actually how do we prevent an unnecessary deployment of a first responder to begin with. And so if a call comes into 911 or PSAP, how do we coordinate that to get that across if there's not a public safety or a medical emergency situation, and how to coordinate that. I know that Colorado's done a great job with those collaborative efforts. Our goal and target is to continue that and expand that as we build up our partnerships. We have kind of a unique model that's been replicated in St. Louis, as well as a similar model in Houston with regards to PSAP co-location and developing policies and procedures alongside of those efforts to really ensure that we're able to, again, create that seamless transition. So our biggest success has been with law enforcement coordination and collaboration. Fire and EMS is a longer term journey for us to gain those handoffs just for medical dispositions and handoffs and reimbursement challenges that come with those operations. But thrilled to be here today. I'm going to pass it off to Cassie just to provide a little more info.
Sure. So I'll start and then I'll have you kind of continue, Jeff, so you can jump in wherever you want to go, wherever I get it wrong. So we are just excited always to get on new partnerships with our emergency services responders partners, and so we've been working with them for a very long time in just kind of different iterations in Arizona, and then when we took over in Oklahoma in 2022, we started to develop those relationships. So I'll start with Arizona first. We really initially started with just a lot of data sharing and collaboration back and forth before we started our co-location. Just kind of getting a sense of where we were at. We knew we were getting calls from different law enforcement agencies, fire and EMS, but there was really no tracking, and it wasn't really any kind of way to evaluate our success. So we kind of developed what we called the co-location model after many conversations, starting with Phoenix PD kind of way back in 2015. Feels weird to say way back because it also feels like that was yesterday, but that was a very long time ago. And so we worked with Phoenix PD initially just to kind of get a sense of how we could better help and better partner. And then it kind of snowballed from there, and we started working with all the major cities across Arizona. And just recently we're able to expand into some of those more rural communities up in northern Arizona, which is very exciting. As well as Southern back in 2022 when we took over as the statewide crisis line. So we've been just working with those folks on policy and procedure. How do we get through the liability concerns of handing over those calls to the crisis center? What does that look like for each PSAP? We believe in really individualized, we want to make sure there's an overall structure to our programming, but we also have the utmost respect for every community operates differently, and even within certain cities, they have just different needs and different things that come up. So our process is really to meet with each PSAP that we partner with for a period of 2 months while we're kind of going through that co-location hiring. And we work with their comm center, we work with their chiefs, we work with kind of anybody who wants to be a part of our partnership. We train them on what crisis does and what we don't do, and how our process flows work. Sometimes we have folks come in and shadow our staff, and sometimes they offer to let us go on ride-alongs or shadow as well. And we always welcome those opportunities. But during that couple-month period, we work on policy and procedure development and kind of what calls are coming in. What can we be most helpful with? What's most appropriate for us to take? And then from there, we are in Arizona co-locating staff, which just means that we have a crisis specialist in the comm center or the 911 center, whichever works for that PSAP. And that co-located staff is responsible for really just giving guidance to the dispatchers, the call takers, as calls come up. They're in the CAD system, so they become part of that law enforcement PSAP, and they do the background checks, they do, all of the requirements there. But they sit in that center to build that trust and relationship with the team, and then also act as a liaison between our site and the team there at 911. They're able to quickly get, mobile teams out if that is the request of law enforcement, and then they're able to kind of guide any calls that we can take, that maybe don't need that law enforcement response. So it's really just a big focus on collaboration, and then, having that co-located staff there has been really successful for us in a lot of ways. In Oklahoma, we are taking a less co-located approach and more of that collaborative. We have regular ongoing meetings with our partners to talk about successes, talk about challenges, areas for improvement. We usually meet once a month with those folks, and whatever cadence they choose, and just gives that opportunity for transparency and collaboration. I'm not sure what I'm missing anything. Data-wise, we started really small. We were getting maybe a couple hundred calls diverted over to us or sent over to us a month, and as we kind of were able to share that data transparently, we were able to show certain ships that maybe weren't kind of on board yet, or maybe weren't as educated on how we could assist. And we worked together collaboratively with those PSAPs to increase. And I think we're just over 3,000 calls a month that we're able to truly divert from the 911 system at this point across the state of Arizona. The volume in Oklahoma is a little bit lower just because the overall volume is a little bit lower, but percentage wise, they're probably about just where we started at. They're probably at about 300 or so diverted calls a month, which is a pretty big success since that program is so new. Yeah, there were 3,000 calls a month is a pretty big success, because those are times where law enforcement didn't have to go out. And so we were able to kind of truly take that over. And we did community stabilize, meaning they didn't need any other services on about 60% of those calls. Our overall community stabilization rate is fairly successful. It's at about 88% statewide, and then 91% for 98. And then in Oklahoma, it's around the same. It's about 90% of all calls are community stabilized and able to just be resolved over the phone. So we consider that a pretty big success in the community, and keeping people in their homes and engaged in ongoing community support. Jess, do you want to add anything?
Oh, I think Cassie covered it very thoroughly.
Is that a lot of words? Really fast, so maybe just drinking this energy drink over here, so it's guiding my discussion.
Great, thank you. Does anybody have any questions for Kelly or the Solari team?
I did want to jump in and just add one quick point of clarification, because we've gotten a lot of questions about this. While Solari has been, yes, they originated out of Arizona and they're in Oklahoma, our workforce is actually going to be in Colorado. In fact, the call center is going to be, they're taking over the same space that Rocky Mountain Crisis Partners has actually existed in. So, we've gotten a lot of questions about what does that mean for workforce? Will these folks really know Colorado? The answer is yes. They've also done an incredible job of prioritizing the existing workforce with bringing over current RMCP staff during this transition, working with them closely to train during off hours so that they are able to maintain their employment RMCP and then transition right over to Solari. The public safety positions that some of you have worked with through Maddie and Amin, those positions are still going to be in existence under their contract. So that's something that we just wanted to really highlight, as this is Colorado. This is really Colorado based, and there is such a commitment from the Solari team of, while they come with different experience and success stories from other states, they're very committed to being flexible and working with whatever the needs are of our community. And so that's been a great conversation that we've had over the last several months, and we'll continue to bring forward as we meet with all of you as PSAPs. What are your community needs, and what's the model that works for you? So those are just a couple other pieces that I wanted to kind of mention, since we've gotten some questions about it in recent weeks.
Great, thanks, Kelly. Does anybody have any questions? Alex?
Hi, this is Alex Wall out of Metza. I just had a couple questions. First one in terms of interaction to 988 and 911 for transferring calls and engaging 911 when a 988 call may need it. And then in the other for technical assistance and how we would, or contact information for how we would troubleshoot certain things. Both these questions are in regard to a specific instance we just had last week where somehow a 911 call rang in and there was an immediate hang up, it sounded like, on the audio, and then a 988 representative working remotely out of San Antonio, Texas was on the line and seemed genuinely surprised and kind of confused that she had been connected to 911. And without the original caller there, it seemed like there was just a disconnect in how that connection had happened and why a caller out of San Antonio had come to 911. But it did have a 911 location in West Coast jurisdiction in the alley out of San Miguel County. So just kind of more information about how that process works and how something like that might happen and what we would do to troubleshoot an issue like that or others.
So I'll take a first pass at what when we backtrack some of these calls is, so the 988 routing has been a big topic of conversation, especially with our 911 partners. And so 988 is still routed based off your area code. So for transplants like me, I have a Michigan area code. I'm going to get sent to the contact center in Michigan. Now there's always a possibility if the home center can't answer within a certain amount of time, it's going to roll over to a backup. That's sometimes how calls can get to centers that are not where they're physically located. Same thing can happen if someone self-selects one of the specialty lines. So there's a Spanish subnetwork, there is an LGBTQ youth and young adult subnetwork, veterans line. And so there's some things where it's not always going to get routed to where the person is physically located. So it's a little bit of a game for the contact centers in those emergency situations to figure out what is the closest emergency response. And so I will let the contact center experts here actually explain what it looks like real time. My experience so far is what I think Solari probably does is what Solari does. I think across the network, it's not as harmonized as what we would like to see. I think there's still a little bit of choose your own adventure of how quickly especially some of the smaller centers can identify where does this person need emergency response dispatch. I'm wondering if maybe that's what happened, because the challenge sometimes with 988 is we can speak really confidently as a state about what happens with the services that we contract. We're really trying to move towards more continuity across the network because these are the type of one-off challenges that cause a lot of anxiety in community about what is the experience really going to look like. My guess is that this was a game of literal telephone trying to get this person who was in an emergency episode, emergency services. And what I would say is that's not something that Solari would do or RMCP would do, but we do hear instances of this happening with some of the other centers. But I do want to take a pause and say, Justin, Cassie, in your experience, I'm sure you've heard of situations like this as well, and it's a lot of backtracking to see where the contact originated.
Yeah, I'll take this one. It's exactly that, right? Like we run into issues, especially with the routing, where we're often receiving calls with folks that aren't in Arizona or Oklahoma Center may experience calls outside of Oklahoma, and so our staff are all trained to kind of identify that and quickly kind of if emergency services are needed to find the most appropriate center. We do have some resources available through the network, through Vibrant for 988. At all centers have very similar availability and training on resources as far as that goes. But there are times where it doesn't quite get communicated right from the caller when they're in that emergency situation, and maybe they say a county and they're just not familiar with it. And so kind of trying to navigate through that as Kelly said, is a bit difficult for some of the centers. From our side of things, how we basically try to navigate through that is we kind of take that feedback from our partners and do research, and most of the time it is in our center, but we do have those connections with Vibrant and with the other centers that we can kind of research into what happened and kind of try to give that feedback to that center or give that feedback to, you know, whomever is involved in that to hopefully navigate through the process better the next time. But I would imagine it probably is what Kelly said, is that routing issue, which they are working on. Justin, I don't know if you know when that is coming.
It's being actively worked on, but again, we're hoping by the end of the year we'll have a resolution.
To have some, that's gonna really help a lot, for a lot of different reasons, right? That physical location is important. I'm sure as you all are aware in work that you do as well. It's really important for us, too. So, we're really hopeful that they'll get there. Until then, we're just kind of working through it. And one of the biggest points of collaboration that I talked about, that we cover in those monthly meetings, but we certainly make sure that all of our partners have a direct contact to address those issues immediately. So you'll get both. We'll make sure that you have points of contact. As Kelly said, we are bringing over those positions at a management level, and so our expectation is you know, they'll communicate with you directly. But I get calls from Phoenix PD here at midnight, 1 a.m., 2 a.m. To address any issues. We're all very much collaborative in the moment, and then anything that we can manage in those meetings, we want to make sure that we're just addressing any issues as they come up quickly for you all.
I appreciate your guys' thorough answers, and not to try to solve a particular issue. I guess just in the way that it came with the 988 representative being kind of like a bit surprised that they were connected to 911, and the fact that Allie came through, just trying to figure out for us if that was actually the original caller had dialed 911 and then patched in 988 or some weird glitch, just because that, and that was like, with it being so new, we weren't sure if there was some sort of automated way in your call center or a quick button in which, you know, a 988 representative could transfer a call to 911 and it would utilize that original calling number to select a PSAP and then push Allie through by the normal bidding process or some other form of routing.
We don't automate that at all, just for that reason, right? Like we don't always know. I mean, our call staff are remote, and so they're kind of located all across the state. And so when they dial 911, like it's all kind of based on that. So we don't do any kind of like auto routing or anything like that. I'd imagine, I'm honestly not sure. There isn't a way for callers, I don't think, to like connect us with other people. And so I would imagine, again, I can't speak to another center's phone system, but they may have somehow misdialed, or there may have been a situation of like we have a speed dial system or something, and it may have just been a wrong click, or it may have been a situation of dialing an outbound number and something came up. But yeah, it's exactly that in those situations. So we would be able to reach out to that center too and discuss that and kind of just make sure that it isn't something that is a bigger issue, right? Is this just a one-time glitch? Did we press the wrong button? What happened there? So we take on that research for you all and make sure that we get a response of ensuring this isn't a systems issue, right? This is a one-off and not something that we have to worry about in the future, or is it an education of that center, or whatever it is that we need. But we have regular meetings as network centers that we're able to do that engagement with.
Kelly, if you're
Perfect, yeah.
a person, would you mind putting your contact information for Alex to ask any additional questions? Okay. Does anybody else have any questions for Kelly or Solari? Okay. That is everything on our agenda. I will ask if anybody else has anything for the good of the order. Jennifer, do you have anything else?
I do not. We have a lunch and learn on August 15th. We'll have a presentation by Virtual Academy. And our next meeting for the task force is September 12th. We'll have a hybrid online and in person at Eagle County. So more mountain areas to be traveling to.
Perfect. Well, if nobody has anything else, I will ask for a motion to adjourn.
This is Ryan at Vero. I move we adjourn.
Got one on the second.
Great. Thank you, everybody. I'll show the meeting adjourned at 11:38.
Take care, everyone.